Hello, my name is Elizabeth Francisco. I am a certified genetic counselor with the Greenwood Genetic Center. This video is about a new screening test that is available to all women during pregnancy, known as non-invasive prenatal screening, or NIPS. You may also hear it called NIPT, or cell-free fetal DNA. What does this test look for?
We all have 2 copies of 23 unique chromosomes for a total of 46. The first 22 pairs are the same in men and women and are called autosomes, and the last pair are the sex chromosomes, an X and a Y in males and an XX karyotype in females. An egg and a sperm each have 1 copy of these chromosomes, so when they come together, they will form the 23 pairs for the baby. However, sometimes a difference occurs in the egg or the sperm that results in the egg or sperm having 2 copies of a chromosome. If one parent brings in 2 copies and the other brings in 1, the baby will have 3 copies. If a baby has 3 copies of a chromosome, this is called a trisomy. The most common trisomies we see in pregnancy involve chromosomes 21, which is known as Down syndrome, chromosomes 18, 13, X, and Y. Trisomies are more common in babies as the mother and her eggs age. Sometimes an egg or sperm will be missing a chromosome. This is called a monosomy. This typically occurs with the X chromosome and is called Turner syndrome and is not related to a woman's age. NIPS looks at small pieces of chromosomes from the placenta that are circulating in mother's bloodstream. This is done through a regular blood sample, and there is no risk to the baby. The test sorts each piece into a bucket based on what chromosome it looks like. If one bucket is fuller than expected, that means there are more pieces from that particular chromosome, and the baby may have an extra copy of that chromosome. If a bucket holds less than expected, that may mean that the baby is missing one of the chromosomes. This test only looks at chromosomes 21, 18, 13, X, and Y. Your test result will come back as either low risk or high risk for a chromosome condition. Your results will be based on your age as well as the blood test finding.
If your result is low risk, then the chance that your baby has one of these conditions is 1 in 10,000. This is not 0, but is significantly reduced. You will have an anatomy scan or ultrasound to make sure there are no visible problems or signs of a genetic condition. If your ultrasound shows no concerns, the risk for one of these conditions drops even more to 1 in 20,000. If a problem is identified during your ultrasound, you may meet with a genetic counselor to discuss these findings and other testing options. If your results come back as high risk, you may meet with a genetic counselor to discuss the condition and further testing options. Further testing includes an ultrasound, which can identify 98% of babies with trisomy 18 and 13, as well as 50 to 70% of babies with Down syndrome. Testing may also include invasive diagnostic tests such as amniocentesis or chorionic villus sampling. This is the only way to have a definitive answer in pregnancy. It is important to know that it is your choice whether or not to have further testing. Your genetic counselor is there to provide information and support you in whatever decision you make.
Since NIPS analyzes the X and Y chromosomes, it will also screen for a baby's gender or sex. While this is over 99% accurate, it should be confirmed with ultrasound. It is also possible that this test may come back with a more complex result that will require discussion with a genetic counselor. NIPS is for women who are at least 10 weeks pregnant with a single baby. While this test can be used with twins or other multiples, it is less accurate. NIPS will help a woman know their risk for Down syndrome, trisomy 18, trisomy 13, and sex chromosome differences. It cannot screen for all birth defects or other conditions that may run in a family.
Some women choose to have this test to prepare for a baby who might have special medical or other needs. Other women may use this information to guide further testing and pregnancy management decisions. Some women, however, will find this test causes undue anxiety. Only you can decide if this screening is right for you. This test can be done anytime after 10 weeks, so you don't have to decide today. If you have more questions, talk to your healthcare provider. You can also visit our website for further information on NIPS and genetic counseling.